the current treatment is now chemotherapy only, and I think in the US, Brentuximab is already approved for salvage treatment, but in Europe it's not. So here we cannot yet add Brentuximab to the chemotherapy prior to autologous stem cell transplant. But I hope in the future it will be possible, at least for relapsed patients in which we showed an improvement. And additionally, I think that checkpoint inhibitors are very important for refractory patients, since these patients are refractory to chemotherapy. And we also showed that there's no improvement for them when you add BV to it. So I think checkpoint inhibitors in the salvage line for refractory patients would really be a good option to investigate. But of course, there are more clinical trials needed that compare checkpoint inhibitors to BV in the salvage treatment setting, and also that compare chemotherapy to checkpoint inhibitors as a pre-autologous stem cell transplant regimen. And it's also interesting to see that maybe we can abandon the autologous stem cell transplant in the second line, because we think that now we use autologous stem cell transplant for about 20, 30 years now, but it's based on 2 very small randomized trials that showed an improvement with high-dose chemotherapy followed by autologous stem cell transplant. But we think that now with the novel drugs that have been created, such as Brentuximab and checkpoint inhibitors, that it might be possible to cure patients without an autologous stem cell transplant. So, for example, with checkpoint inhibitor maintenance instead of an autologous stem cell transplant. And that would really be an advantage in the Hodgkin lymphoma treatment, since these patients are very young and autologous stem cell transplant is very toxic. And it also causes a lot of long-term side effects. So if we could prevent that, that would really be a great improvement in the treatment of Hodgkin lymphoma.